Hello, big guy. How you doing?
Say hi, Malik.
9-year-old Malik Thompson is getting his annual checkup.
Great job.
Good job.
I see big brains in there.
Malik is autistic, so Mom Melissa says it's especially important to catch small issues before they become big.
I don't wait until I think they're sick. If they're coughing or if they have a runny nose, I call the doctor right away.
Melissa admits she calls for pretty minor complaints, but even so,
I've never had a problem getting an appointment.
Malik's health insurance, just $75 a month. It's a program called California Kids, a nonprofit insurance plan that
enables them to see a doctor.
Their own doctor. Anytime a kid might need one.
If they need x-rays or any kind of diagnostic test, any blood test, they have a doctor.
California Kids doesn't cover hospitalization, but it does cover preventative care, outpatient surgery, prescription drugs, therapy, and dentistry. Melissa says fixing Malik's teeth was huge.
Because he's autistic, he had to be put to sleep. So they were able to do the exam, they were able to fill the cavities and everything on that one visit.
Program Director Michael Koch says California Kids was created for kids whose parents can't afford conventional insurance or don't qualify for government plans.
If you're not eligible for Healthy Families or Medi-Cal, then California Kids is a good option.
Any child 2 to 18 qualifies. Koch says lately the biggest demand is coming from kids whose parents have lost their jobs and have fallen off their COBRA plans. Parents like Melissa.
Currently, I do not have health insurance. But that's okay. My kids have health insurance.
Dr. Hector Flores says that peace of mind alone can help parents succeed on the job front.
Because what we see, patients who have uninsured children, they're out missing work because they're out trying to figure out where to get their children plugged into care.
But when parents know their kids are okay, they're
more likely to be productive in their job.
Melissa looks forward to the day she and her husband are back among the insured. But for now,
I tell you, I have been 125, 30% happy.
Now joining us to answer more questions is Michael Koch, the founder of California Kids, of the Healthcare Foundation. Nice to have you here, Michael.
Oh, thank you.
So the typical cost for this program is how much?
Well, the typical cost would be $75 per child per month.
And in the typical families now, we say that some folks who have recently lost their jobs are among those, but what would be a typical family that would come to you?
Well, a typical family would be a family that either lost their job or the employer doesn't cover dependent care, or in what we're seeing now is an increase in high deductible plans. So, for example, a family may have insurance, we call them underinsured because they may have a $2,500 or $5,000 deductible, and that would not cover their preventive or primary care, and so that would be an out-of-pocket expense. So that's an increase that we're seeing that we didn't see several years ago, and that child would be eligible for California Kids.
It seems like a free market solution to a problem that the government is trying to solve. Is that the way you saw it?
Well, we were established 18 years ago, and we've insured over 70,000 kids in 18 years. And what we saw was a need that the children were getting their health care in the emergency room. And we thought that was unacceptable, that to have a medical home where the parent knows their doctor by the first name and not their emergency room doctor by the first name was the goal of California Kids.
All right, so what happens to children who need to be hospitalized, something more catastrophic perhaps?
Well, we've, again, been in operation for 18 years and have established a connection with the government-sponsored program. So we would act as a liaison. So in the event that a child would need inpatient, we would link them with a categorical program, let's say emergency Medi-Cal, and or many of the hospitals have charity care, and so we would link them with the charity care at that hospital. So we don't abandon a child. We ensure that that child continues a continuity of care and then gets the inpatient care that's necessary.
Is it accessible to everyone? Is there like a waiting list for people to get on this program?
We don't have a waiting list. If a child is eligible for one of the government programs like Medi-Cal or Healthy Families, then we work to link them into that program. Since our program is philanthropically funded, meaning that foundations and businesses donate to California Kids and then we subsidize the care, that if they're eligible for one of those programs, then we certainly want to link them into those programs. So this would be for children who fall outside of that, where the child is not eligible for Medi-Cal or Healthy Families, and yet commercial coverage is too expensive for the parent.
Michael Koch, Director of California Kids, thanks so much for being with us.